Physician burnout, a long-term stress reaction marked by emotional exhaustion, depersonalization, and a lack of sense of personal accomplishment, was already a growing problem, and the COVID-19 pandemic has made it only worse. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Senior Writer for AHA. In this podcast, David Zaas, Chief Clinical Officer for MUSC Health in South Carolina and CEO of its Charleston Division, talks with Nancy Foster, AHA's Vice President for Quality and Patient Safety. They discuss strategies and helpful tools to address burnout as healthcare professionals continue to care for COVID-19 patients.
Hello, I'm Nancy Foster, the Vice President of Quality and Patient Safety at the American Hospital Association. With me today is Dr. David Zaas, Chief Executive Officer of the Charleston Division of MUSC Health and Chief Clinical Officer for MUSC Health in South Carolina. Thank you for being with us, Dr. Zaas. As you know, we continue to see COVID cases increase in many states. So as we start this, would you please set the stage for us and tell us what's happening in your community and what you're dealing with now?
Thank you, Nancy, for the chance to be here. It's hard to believe that the COVID journey we've been on is still only 6 months old. It seems like so much longer that we've been preparing for how we as an organization care for all of our community in the setting of the pandemic. Like most hospitals and communities across the country, we've gone through several phases from our initial preparation without a lot of knowledge and experience in the spring to a large surge throughout the summer and an increase across our community, across our hospitals. Over the last several months, while the numbers of positive tests within the community, the number of hospitalized patients has declined. We've continued to build our capabilities, knowing that next wave is coming, knowing that we need to learn not only from our experience this summer and spring, but from all of our peer organizations around the country of not only how we safely care for COVID patients, but really how we provide what we call perfect care in a COVID world. And part of that is caring for our team members.
That's a wonderful introduction to the issue we really want to get to today, which is around burnout. Healthcare has always been a 24/7, 365-day-a-year job. And while COVID has not changed that, it has had a draining effect on many of our colleagues. For many healthcare professionals and frontline caregivers, the pace and intensity of what they're handling every day feels different. As a physician and a leader in your organization, what do you see as different about this pandemic that is making it so stressful for people?
So I think as we look through the different phases of our response to the pandemic, we've seen different factors that are really creating the stress on our system. When we started, we had a lot of emotion and fear and very little knowledge and experience, very little understanding of risks to our caregivers, to our colleagues, our community, and their families. We had lots of concerns around, do we have the tools that our teams need to do their job well? Do they have the protective equipment and the resources to care for this large volume of patients? I think that really framed our initial response. And I think it created a huge stress on an unbelievably committed team due to the uncertainty and the lack of knowledge, due to how different this was from what we normally do, even in our critical care environments. I think 6 months later, We're more prepared than we've ever been, but it's still a different kind of stress. We've learned that we can safely provide care in a COVID world, that with the right protective equipment, that our team members can be in the hospital caring for all of our patients, including our COVID units, and do that safely without creating risk to themselves and their family. So that's been absolutely critical. We've really committed to hiring team members to prepare for the next wave and the future waves that we know are going to come, in order to ensure that we have the team to care for that volume. We've invested heavily in protective equipment and testing, so our team members are confident that they will have those resources available. It's still important that we recognize that this stress is real, that this is straining our systems and capacity in a way that we've not seen. And the final part is really acknowledging and recognizing the commitment, the compassion that our teams have shown, that I think are critical to the success of us achieving these goals, the success of us saving lives in the face of the pandemic.
Thank you. That's critically important. Not everyone listening to this podcast will be a clinician like yourself. Could you just take a moment and remind us of some of the signs and symptoms of burnout among our colleagues that we might be observing, that might give us a hint that we really need to, in all sorts of facilities across the country, improve our efforts to address burnout? And then, if you wouldn't mind, also say a word about the implications of burnout, not only for our colleagues, but for the patients and communities we serve.
The foundation for all of our work, our quality, our safety, our patient experience, is really having a healthy care team. That care team needs to be able to care for themselves in order to be able to care for patients at the level that we know that they are capable of doing. I think there's three components that I think about every day of what we need to do to really mitigate that risk of burnout, as well as trying to recognize it. So let me talk about each of those three. The first is our team members really need to believe they have the support to do their job. They have the resources to keep themselves safe. The second part of our guiding principles is that team members need to be able to have control over their environment to try to improve how they deliver care. And they need to be actively engaged, especially in the setting of COVID, where things are changing so quickly, of how we learn to do this better, to really know that they are valued. And the final is that they need to be appreciated, not just by our leaders who need to be visible and present, but by their peers. So I'm convinced that if we can do each of those three things, if we can give them the tools to do their job, if we can empower them to improve what they do every day, and if we can make sure that they are appreciated and respected by their leadership and their peers, we can really mitigate those risks of burnout. We still, to your point, need to be vigilant in looking and surveying, how are our team members caring for themselves? Are they able to engage as part of our solution? Are they able to rest and care for themselves and spend time with family outside of work? Are they able to stay engaged like they do every day in those solutions, or are they starting to detach and pull back? Are they continuing that positive outlook that we know is so foundational to all of our healthcare workers, that know that they're coming into work to make an impact on our community every day? So we've really done a lot of work with our leadership around not only how they create that environment to minimize that risk, but how they recognize burnout within their team members, so we can try to intervene and really focus on caring for ourselves is critical for their ability to care for others.
You know, I'm going to borrow your phrase. I so appreciated what you said at the beginning. The foundation of all we do is a healthy care team. That is so emphatically right, and conveys the message so well. Thank you for those words and the 3 points you've made about ensuring there are the resources, controlling the environment, even though we know that evidence and the therapeutics and other medical treatments will evolve rapidly, and then making sure people are appreciated. I was recently asked, and I'd be curious about your reaction to it. Early in the pandemic, it seemed that there were lots of accolades for healthcare workers and lots of organized sessions of people celebrating the healthcare workers. That seems to have tapered off a bit from the public, and I wonder if that too might be adding to the sense of burnout that our healthcare workers are seeing, because they're not feeling that enormous appreciation that came to healthcare early in the pandemic.
Nancy, I agree with you. Early on, that support from our local community was critical. The meals that were donated, the signs, the recognition for our healthcare heroes, the realization that our team members were putting themselves and their families at risk to help others. And that support, I think, really did help us in those early months and during that surge throughout the summer. I think we're getting into a different phase, and I don't know if that can be sustained in that same way. But I am confident that our team members right now have more facts and less fear. I think that we have recreated some of that support and appreciation within our teams and within our leadership that is really essential to our team members feeling valued every single day. I think all of us know we may not see as many signs. We may not hear the clanging at night or the food delivery that was done from the community, but I truly believe that we've shifted the attitude in our community, that they really do appreciate all that our healthcare teams are doing. And I hope that our team members recognize that as well. So it may not be as visible, but I think healthcare has never been more appreciated by our community. And I think that may be one of the benefits that even outlasts this pandemic, to people to value how important our healthcare givers and our healthcare community is to the foundation of everything we do within all of our cities.
Dr. Zaas, until a safe and effective vaccine becomes available and widely used, healthcare workers will continue to have to care for many friends and community members with COVID. And since we don't have that clear finish line in sight yet, could you talk a little bit about what you personally have found to be the most effective things you can do to help healthcare workers keep themselves well by either preventing or addressing burnout in your organization?
So we have taken a series of steps, like most organizations, to really help care for our teams and keeping them well. The first part is leading within our community, within our best practices, to keep ourselves physically healthy. The importance of our social distancing and hand washing and wearing masks, not just when we're at work, but when we're at home with family and out in the community, to realize that it is important that we need to keep ourselves healthy so we can fulfill the need that is so great within our community as our nurses and physicians and all of our staff, even outside of our clinical areas. We've been very vocal within our organization and in the local community, again, around the importance of everyone following all of our best practices. in order to keep our community safe, in order to prevent overwhelming our hospitals, and keeping our care teams safe. We had some team members that, again, stepped up in ways that you could not imagine during the pandemic. We had team members that left Charleston to go to New York and Atlanta and other hotspots when we knew that our case numbers were much lower. And then they came back to MUSC into the summer when our numbers started to climb. And it was a huge value to the organization. A credit to those team members. They were selfless in wanting to go help into those communities that they knew had greater need than we did in the spring. But when they came back, they brought such value to the organization and to their peers. They had been through the response in a hotspot in another city in a different system. They appreciated the support and work that was done, but they also really helped us accelerate our learning. And maybe most importantly, I think they helped support each other. They supported their own team members that had not had that experience that they gained throughout the spring there, that really, I think, helped our team not only survive, but thrive in the setting of our surge throughout the summer. I'll never forget a large note that was pasted outside of our COVID ICU as we were getting ready to consolidate as the surge started to wane. And the note talked about how our COVID ICU team had bonded so well and were so excited to stay together because they realized how much they had done as a team. So one of our, I think, foundations as we think around preventing burnout, right? It's not just supporting the individuals and all those things that I talked about, right? But it really is creating the team and how we create the environment that the team is what will allow individuals to thrive despite the stress that they're under.
That's amazing. Listening to you speak, I'm reminded of some of the leaders of SEAL teams and others talking about the crucible of action and how it bonds the teams, and that makes everyone stronger and more able to get through the tough times. Sounds like you achieved it in your own organization, and I'm sure many leaders feel the same across the nation. One final question for you, Dr. Zaas. You're a member of the AHA's Physician Alliance, and as part of the work that alliance has done, you released a well-being playbook about a year ago, before COVID, and it was intended to help people deal with burnout. How could you, or what would you say would be useful for the AHA and its leaders, such as yourself, that are part of the Physician Alliance or other bodies within the AHA? What could we do in order to better help our members through this time and in dealing with the incredibly valuable staff in our member organizations to make sure they stay well and continue to be able to contribute?
I really appreciate the leadership that the AHA has taken well prior to the pandemic around the importance of wellness within our healthcare teams. We talk about the incidence of burnout in COVID, but I think it's important that we also recognize we had a problem with burnout in healthcare well before COVID. This has been a long-standing challenge that we've all focused on, but we now recognize, right, we need to take that to a different level. We need to raise our focus to ensure that we have a healthy care team in order to provide the best care. I think, again, one of the positives that will come out of this, not just valuing our healthcare teams, but supporting them in their journey. So wellness is a focus of what we do. And COVID will be gone within the next several years and will change But I really hope that our commitment to say that healthcare is still a stressful business, caring for people in some of their most difficult moments, supporting families at the end of life, always will create stress for our care team. So how do we not only really take these lessons from COVID, but hardwire those processes to say we should always value our care team members, not just within our community, but within our teams. We should always ensure that they have all the tools that they need to do their job and that they're empowered to continue to improve what they do every day, and that they truly are appreciated and can build teams. And I will be the glass half full that if we do that well as an organization, with the leadership of AHA and other organizations, right, we will come out better on the other side of this. We will be better from what we've learned clinically, but maybe most importantly, right, we will be better at how we care for our teams, which will allow them to provide better care to patients and families for decades to come.
Thank you so much, Dr. Zaas. Just listening to your commitment and your optimism, I think lowers my blood pressure and makes me feel better. So thank you for that. But really appreciate the comments you've made about how we can all come together to reduce stress for our care delivery teams and really ensure that they feel valued and supported, and that we stay together as we have to continue to battle COVID. Thank you for your time and all of the work you're doing. Very much appreciated.
Thank you, and I hope everyone stays safe.
You too.